Greiwe. I'm going to be talking about labral tears today and how we fix labral tears in the shoulder. Labral tears occur typically following some type of traumatic injury to the shoulder. Sometimes a dislocation can cause a labral tear, other times repetitive motion such as overhand throwing or spiking a volleyball. Things like that can cause labral tears. Occasionally they'll also occur over time on a chronic basis. The labrum is actually a lip of cartilage that surrounds the socket. This is the socket of a shoulder. It's sort of pear-shaped. It has a wider lower portion and a more narrow upper portion here. And the labrum runs right around the outside of this socket, and occasionally when the ball translates out of the socket, it can actually tear or injure the labrum. So occasionally we have to repair those. When I fix a labrum, we use an arthroscopic technique, and we'll make small incisions around the shoulder. We'll introduce a camera so that we can see the labral tear, and then we'll place small anchors in the bone to stabilize the labrum, and we'll pass the suture through the tissue of the labrum in order to stabilize it. We'll tie it, and then the patient has a nice stable labrum that they can heal. Typically, labral tears take about 10 weeks to 12 weeks to heal completely. So we recommend initially, after the arthroscopic procedure, the patient starting with physical therapy. Typically this is an outpatient procedure. They'll come back to the office about 7 to 10 days later, have the sutures removed, start physical therapy. And with the physical therapy, we'll be starting to strengthen the shoulder about 4 weeks to 6 weeks. After that, the patient comes back into the office, we check their motion, and typically by about 10 to 12 weeks, the patient's doing much better and has a nice stable shoulder. Hi, I'm Dr. Mike Greiwe. I'm a shoulder, elbow, and sports medicine specialist at Commonwealth Orthopedic Centers.